Marcus, how are you today?
I'm good, how are you?
Good. So today we're going to be going over your care plan. So basically it's just all your goals, outcomes that I've created for you to create a healthy oral environment. The end goal is to improve your oral health. So if you have any questions, concerns, just let me know. Does that sound okay?
Yeah, for sure.
Perfect. Okay, so looking over your first diagnosis, I did diagnose you with generalized periodontitis. Can you tell me a little bit about that?
Yeah, I don't know that much, but I know it's a disease, but I don't understand too much about it.
For sure. So I have these fact sheets here that kind of explain what periodontal disease is. So basically, it is an infection that starts in the tissue and generates into your bone structure. And looking over your radiographs, we did see minimal bone loss and we did see inflammation based on your periodontal assessment. So that could explain some of the bleeding that you did have.
Okay, that makes sense. So what do I have to do?
I'm glad you're so eager about your oral health. So over the next few weeks, I'll have you come in and I'll do something called debridement. So basically that will remove all of that unwanted biofilm and build up on your teeth. Some risks are that it may cause a little bit of inflammation after treatment, but the benefits always outweigh the risks as it will create a more healthy oral environment for you. Another intervention I want to go over with you is string floss and the Bass brushing method. So it's great that you're already brushing twice a day, but I will have you do this technique that I will demonstrate on a model for you, and then I'll have you incorporate flossing at least once a day.
Great, but I've never actually learned how to properly floss.
That's okay. I have a model that I can show, and then I also wanted to go over some periodontal education. So it's really important to recognize the signs and symptoms of periodontitis and to know what to look for when you are doing your oral care.
I think that's a great idea. I just don't know much about it.
That's okay. I have lots of resources we can go over and for you to take home as well. Okay, so moving on to your second diagnosis, I understand that you play sports, but you do not wear a mouth guard.
No, so I'm actually new to hockey and I didn't really know you needed one.
That's okay. Sometimes it's confusing when to know when to wear one and when to not. It is important to wear a mouth guard during contact sports because it will protect your teeth as well as the surrounding tissue because we don't want any trauma or injury to your mouth. Do you have any questions or comments so far? I know this can be a lot of information all at once.
I don't think so. I'm just trying to take in all the information.
For sure. So moving on to your third diagnosis, I understand you smoke a pack of cigarettes a day. Can you tell me a little bit about that?
Yeah, so I've smoked for around 10 years. I tried quitting, but I just couldn't do it.
Yeah, for sure. It can be hard, but I believe you can quit and stick to it the next time you're open to it. But with that, I do want to teach you some oral cancer screening techniques. It's really important to assess those things and we can catch them early on.
Okay, great. Yeah, that sounds like something I want to keep an eye out for sure.
Absolutely. I just want to go over the risks of tobacco use and effects on your oral health as well. It's important to understand what tobacco does to your teeth and your tissue. So I know you mentioned that you weren't too happy with the color of your teeth.
No, it's horrible. I actually don't like it. It drives me crazy.
Yeah, for sure. Some of that discoloration can be caused from the tobacco. So something that we can do for that is coronal polishing. So coronal polishing is great for removal of extrinsic stain. Some risks include the removal of a small layer of enamel, but we can replenish that with fluoride. And then the benefits would be to remove that stain and hopefully enhance the white appearance of your teeth. Okay, so we're just going to go over the sequencing of your appointment plans for the future. So your first appointment will include debridement and the brushing and flossing technique. So again, the debridement will just help with that removal of unwanted biofilm. The brushing and flossing will be included into your own care plan, but I can show you that on a model and then I'll get you to demonstrate that back to me as well. Your second appointment will include taking impressions for your sports guard so that you can wear that during your contact sports. In that same appointment, I want to go over some periodontal education just so you can be aware of what to look for when you're doing your oral care every day. Your third appointment will include your coronal polish, so I'll go over that to remove that extrinsic stain and hopefully that'll help with the appearance of your teeth. And in that same appointment, we'll go over some oral screening techniques just so you can be on top of anything if anything were to occur. And then lastly, we'll go over some tobacco education And then I also just want you to know that I'm here as a support if you ever decided to try and quit again, and I can give you those supports. Okay, so how does that sound, Marcus?
That sounds great. I'm looking forward to having whiter teeth.
For sure, your oral health is my priority. So I just want to go or confirm that you consent to all procedures, that I went over the goals, the outcomes, interventions, the risks, and the benefits. Do you have any last comments, questions, or concerns?
I don't think so. I believed you covered everything.
Perfect. So if you want to follow through with this care plan, you can just sign here, but if for whatever reason you don't, you can just sign here and then indicate that here.
Okay.
Perfect. Well, thanks for coming in today, Marcus. We'll see you at your next few appointments.
Perfect.